As Africa navigates the aftermath of COVID-19 pandemic, the challenges facing its health systems remain high. My name is Gloria Milimo, and on this episode of Health Digest, we explore why it's paramount for countries in the region to foster and sustain resilient health systems. Strong health systems play a critical role in providing adequate access and quality health care. As the world emerges from the devastating effects of the COVID-19 pandemic, there is an absolute need to build resilient health systems, systems that advance universal health coverage and actualize the Sustainable Health Development Goals. Public health experts may argue that indeed the pandemic was perhaps a blessing in disguise, for it brought a renewed sense of urgency to initiate health system reforms across Africa. Kenya is among 17 countries in the continent that have been selected to spearhead a World Health Organization's Emergency Preparedness and Response Flagship Initiative. This plan seeks to adequately prepare selected nations to handle outbreaks that have become the norm in the recent past.
The Flagship Initiative was created with the aim of establishing a sustainable, efficient, and resilient system that guarantees early detection of public health concerns and rapid deployment of emergency response. The initiative is part of WHO's new regional strategy that seeks to transform health security. This strategy was developed during the 72nd session of the World Health Organization Regional Committee for Africa, held in Lomé, Togo, in 2022.
By adopting this strategy, WHO member states agreed to reach world targets by 2030.
This program is aimed at strengthening our capacity and other countries to prepare for and respond to emergencies, and particularly public health emergencies. This program, Kenya will be able to detect, assess, and respond to outbreaks and emergencies in a timely and effective manner.
Outbreaks are the norm of now, and therefore we need to be able to enhance our response, preparedness and response structures.
It also requires that 80% of member states have sustainable health security financing, 90% of which should be meant for mobilizing an effective response to public health emergencies within 24 hours of detection.
It also includes the ability of all countries to have 80% of health districts with functional service delivery and quality improvement programs. The Flagship Initiative adopts a three-components operational approach. 1. Transforming African surveillance systems, also known as TAS. 2. Promoting the resilience of health systems for emergencies, or PROS. And 3, strengthening the utilization of response groups for emergencies, SURGE.
A scoping mission was commissioned by WHO among member countries in November 2022 to conduct advocacy meetings with stakeholders within the countries, to conduct situational analysis and develop a government-led roadmap for the full implementation of the Flagship Initiative. The roadmap draws its activities on priorities to be implemented over 2 years, and WHO would provide seed funding to commence the government-led multi-sectoral implementation using One Health approach.
WHO says the Transforming Africa Surveillance Systems component of the flagship will help strengthen the implementation of the integrated disease surveillance and response by providing synergies between different surveillance structures and data sources. This includes the use of electronic systems to detect and respond to public health emergencies in a more efficient manner.
PROS will strengthen Kenya's capacity to anticipate risk, plan for contingencies, and prepare to mobilize human and material resources to swiftly and effectively prevent and mitigate the risk of emergencies. The SURGE project will establish a national-level cadre of locally trained multidisciplinary personnel, put in place systems to improve readiness and response coordination, and strengthen existing infrastructure for rapid and effective emergency response at the national and also sub-national levels.
At least 120 multidisciplinary rapid response teams in Kenya have been trained in readiness for current and future emergencies. They now join a pool of over 3,000 trained emergency responders across Africa who can be deployed within 24 hours of public health emergencies locally.
There's a costed implementation plan which has been drawn at a cost of about $50 million. There's an MOU that has been drafted and is currently under review for signing. There was 118 SURGE staff drawn from national and county governments have been trained on EPR, with the latest group having graduated in Mombasa.
It is another signal that the decision of the government of Kenya to host the WHO Regional Emergencies Hub in Nairobi will bring huge benefits to the country's healthcare system. The collaboration also includes the production of the State Party Annual Report, implementation of the Universal Health and Preparedness Review Priority Recommendations, the development of the 2023-2024 Global Health Security Action Plan, and a roadmap to guide resource mobilization and implementation of the emergencies flagship.
Just like several other African countries, Kenya has been grappling with public health threats like the ongoing cholera outbreak that has left over 7,000 infections and at least 112 fatalities. A report published in the Lancet Infectious Diseases Journal says Africa is witnessing a mounting rise in cholera cases. So far, cases recorded in the continent in January 2023 alone spiked by more than 30% of the total caseload reached in the whole of 2022. Most of the new cases and fatalities were recorded in Malawi. The South African nation faced its worst cholera outbreak in 2 decades. Zambia, Mozambique, Somalia, Ethiopia, Kenya, Burundi, Democratic Republic of Congo, and Nigeria were also hit. Conflict and extreme climatic conditions are said to worsen the triggers of the acute, extremely virulent infection that spreads rapidly, causing dehydration. They include, but not limited to, the Ebola outbreak witnessed in Uganda and the Democratic Republic of Congo. Kenya, on the other hand, is grappling with an outbreak of visceral leishmaniasis, also known as Kaliza, in West Pokot County. Recently, researchers from the Kenya Medical Research Institute, KEMRI, detected a new species of mosquito that showed resistance to locally used insecticides. It has the potential to spread malaria throughout the year, unlike the traditional malaria-causing mosquitoes that Kenyans are used to. The species, also called Anopheles stephensii, poses a threat to gains made in combating the disease in the country. In 2022, Kenya witnessed a number of outbreaks like chikungunya, which was reported in Wajir County, where a total of 291 cases were reported, with 5 confirmed cases. In the same year, there was a flare-up of yellow fever in Isiolo and Garissa counties. The Ministry of Health's Division of Disease Surveillance and Response report says measles was also reported in 6 counties in the same year. Infectious disease experts like Professor Omwanzala of the Kavi Institute advises on the need to strengthen surveillance to help ensure timely detection and response to disease outbreaks.
We now have a problem of emerging and re-emerging pathogens, all right? And these are not only viruses. We are also seeing an emergence of bacterial pathogens, which now are causing disease. Some of them are even difficult to treat. So there's need for very active surveillance across the country so that every county must be reporting any form of disease that is going on. Secondly, we need very quick analysis of that data to actually understand, is this just, are we seeing endemicity or are we seeing any increase in the number of infections that we are seeing within the country, all right? And then number two is having teams together, okay? Having teams together that are ready to be deployed very, very quickly should there be an outbreak in anywhere in this country. Well-trained, well-resourced, isn't it? Well-trained, well-resourced, and with very clear mandate that they can be deployed very, very quickly so that we don't have to take too much time. Working very, very closely with communities. Because the purposes of any outbreak is not to spread it, but to do what? To contain it. Yes, and containing means that you quickly take your team there with all the various experts, quickly ensure that they understand what is going on, quickly diagnose, isolate the organism, get to know how it is spread. But at that time, they'll be working within a confined area so that we contain this disease outbreak. Because before you get to know what it is, you want to be able to keep it under wraps.
Leveraging One Health approach has also been shown to help mitigate outbreaks and respond effectively to health emergencies whenever they occur. Professor Anzala, who is also a virologist, calls for adoption across the region as it grapples with changes in the ecology being compounded by climate change.
There's a lot of infection that occur between human and animals, isn't it? And hence vectors. There are a lot of infections that occur between humans and the environment, and hence the need to bring in organizations like them. So we are putting together all these groups under what we call One Health, because all these things are interrelated. If there's an outbreak of cholera is normally acquired through what? Through orophycal route, meaning that it will be because of the environment. Is there a problem with the sewage and how water is being treated, isn't it? Yeah. So those things are all interconnected, and hence the relationship with One Health. We are also seeing diseases occurring in places where they were never before, because vectors are also adopting themselves. Chikungunya, dengue are viruses that are spread by what? By vectors, isn't it? Climate change and ecology might change so that the vectors that were not there before are now able to exist in an environment in which they were not. So you see an outbreak of chikungunya in an area that had never had chikungunya before. And hence what I talked about, surveillance. All right? Hence the need for constant surveillance. We cannot assume that what we knew 10 years ago is going to hold now and for the future. And also the need for constant what? Constant research. These pathogens are also changing. They are also evolving. So the need to also not only say there is malaria, or there is dengue, or there is cholera, but go further and understand, is the cholera we are seeing in Kisumu the same type of cholera that we are seeing in Garissa? Isn't it? Or are they slightly different? Because we want to see whether they are linked or they are separate.
Strengthening health systems also includes the provision of adequate number of staff to help bridge the gaps. Experts say health systems in Africa are often overwhelmed due to the shortage of critical care capacity. Kenya, on its part, is still grappling with this expert shortage despite thousands of doctors graduating from medical schools each year.
there's such gross shortage of health workers, there shouldn't be migration encouraged from 37 out of the 55 countries are African countries. This shows just how bad the situation is and the need for member states of East Africa and across the length and breadth of the African continent to invest in health, and particularly so in health employment and the improvement of the working conditions of health workers.
Human resource has been identified as a fundamental pillar of any health system. Availability of enough trained and well-motivated human resource can be the difference between a functional and non-functional health system.
It's alarming that every month we have to depend on the agreement between the two levels of government. We need the salaries aspect to be sorted. And that's why we're on a rallying call that we need Health Service Commission. It was in the manifesto of the government. This is a high time that we need to have it implemented to safeguard the service provisions in the counties, in the facilities, so that we do not have interruptions. As healthcare workers and as doctors, we don't enjoy strikes. We don't enjoy boycotting work. But most of the times, like now, when the cost of living is very high, when the bills have risen and the salaries have delayed, it forces somebody who really has a willing to be in the hospital to stay at home. And therefore, this is an urgent call that the Treasury release funds meant for paying workers in the county urgently.
For instance, the doctor-patient ratio in Kenya is about 1 to 10,000 against the World Health Organization recommendation of 1 to 1,000. This disparity continues to widen the gap with each passing year. The strengthening of the health systems will as well, according to experts, involve governments improving their stewardship role, that of development partners and stakeholders, and implementing health sector reforms, among other recommendations. As much as the path towards building a more resilient health system is faced by many challenges, the big task ahead for countries in the continent is how to foster and sustain resilient health systems that are able to address both present and future health crises. Gloria Milimu, KTN News.